Well, today I want to talk about heart disease. Everybody wants to point their finger at cholesterol. Cholesterol doesn't cause any heart disease whatsoever. That was the biggest fraud ever perpetuated against the American public, maybe even the world. We're talking about worldwide fraud here. Trillions of dollars spent on this cholesterol thing, and it turns out to be a dead end, okay? Literally and figuratively. Let's look at the different types of heart disease. Congestive heart failure. Congestive heart failure, the most common cause of heart death in adults in America, maybe the industrialized world. And it has nothing to do with cholesterol. It's a deficiency of a single vitamin. We've known that since the end of the 18th century, in the late 1700s. It was discovered by a Japanese naval surgeon. It's a simple vitamin deficiency, right? I've had people who are on the heart transplant list on 27 prescription drugs, put them on, of course, the Healthy Heart and Brain Pack, threw in the extra de-stress capsules for supplementing with the mega doses of the B vitamins. And guess what? Their cardiologist took them off of 27 prescription drugs, took them off the heart transplant list in 5 days. After 3 years on the heart transplant list, they declared them cured, not me. Very simple stuff. We do this quite frequently because it's a simple vitamin deficiency. Then there's cardiomyopathy heart disease. Cardiomyopathy heart disease, also called hypertrophic cardiomyopathy heart disease. In pigs, it's called mulberry heart disease. Causes sudden heart death in young athletes and people of all ages, caused by deficiency of a single mineral. I'm probably the only one who's ever done 1,700 autopsies on kids under the age of 10 with that cardiomyopathy heart disease. A common cause of the terminal event, the cause of death in people with cystic fibrosis and muscular dystrophy. Okay, and this is a deficiency of a single mineral, selenium. And then there's thrombosis, coronary thrombosis, thrombotic stroke, pulmonary embolism, deep vein thrombosis. This has nothing to do with cholesterol. This is caused by deficiency of, or a ratio problem between omega-3s, 6s, and 9s, and it causes sticky platelets and red blood cells, white blood cells, increasing the risk of stroke. I actually sued the FDA in federal court over this one to be able to say these things, and of course prevailed, so we can say this stuff now. Then there's obstructive artery disease. Oh, there's a big one. Has nothing to do, absolutely nothing to do with cholesterol. Obstructive artery disease, we're talking about coronary artery disease. We're talking about the artery disease in the brain that results in vascular dementia, artery disease in the eye, which results in glaucoma, artery disease in the kidney, which results in the need for kidney dialysis, okay, because blood pressure is going up, the obstruction of the little afferent arteries in the kidneys. Okay, this is caused not by cholesterol, but eating inflammatory foods, fried foods, processed meats, nitrates, nitrites, deli slices, sandwich meats. We're talking about oils. I mean, we're talking olive oil, coconut oil, things like margarines, mayonnaise, salad dressings, cooking oils. Okay? And then what about AFib? Oh, that's probably the very, very funny one. AFib, boy, the doctors will throw $500,000 worth of cardiac procedures at you. They'll install defibrillators, pacemakers. They will do ablation where they kill a portion of your heart muscle. And that's not going to work, of course, because it's a back problem. Then they do retroversion where they electrocute you to death and then hope to awaken you later on after they sung a little ditty. And again, it's a back problem, so that doesn't work. And then, of course, what happens is they put you on the heart transplant list. And they'll run up $500,000 worth of heart procedures for atrial fibrillation when it's really just a degenerative disc disease. The vertebrae are coming closer together, smashing the roots of the spinal nerves coming out from between T1, 2, 3, and 4, the thoracic vertebrae 1, 2, 3, and 4. And so I want you to get a hold of that trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy, and learn how to deal with all these cardiac conditions. Obviously, you want to be on the Healthy Start Pack. Better yet, the Healthy Heart and Brain Pack. That'll allow you, if let's say you weigh 200 pounds, that's going to allow you to have 3 selenium twice a day, which is a mineral that's missing when you have cardiomyopathy heart disease. Then I would throw in the CardioFX. If you're not on medication, now if you're already on medication for congestive heart failure, then you want to stay away from the CardioFX. But if you're not on medication, you can throw in the CardioFX. And of course, for thrombosis, I like to throw in the nightly essence because it has an enzyme in the nightly essence called natokinase, N-A-T-O-K-I-N-S-E, because it dissolves blood clots. And the de-stress capsules, you got to throw those in case it is congestive heart failure, because congestive heart failure is a deficiency of a single vitamin, and it's very easy to support and promote healthy cardiovascular function, support and promote healthy cardiovascular metabolism. when you supplement with these B vitamins, de-stress particularly. Again, get a hold of Let's Play Doctor, Let's Play Herbal Doctor, the Passport to Aromatherapy, and antioxidant. You want to throw in all the antioxidants they can afford. I like Cell Shield RTQ, R for resveratrol, T for turmeric, Q for quercetin. I'd take 5 of those twice a day myself. I throw in the Triple Treat chocolate. I've just had 4 of those just now. I had 2 for breakfast. That's my limit. I limit myself to 6 a day. Gets my ORAC points, my oxygen radical absorption points up over 100,000. Then, of course, I take in every antioxidant I can. We're talking about OPCTs, which has got red grape seed extracts, green tea extracts, extracts from pine bark, and all that kind of stuff in there, OPCTs. And you get those ORAC points up there, you're going to help protect all cell walls in your body, including the cell walls in your cardiovascular system. Heart disease has nothing to do with cholesterol. Stay away from the statin drugs. Stay away from cardiologists unless you're having a heart attack, and then you might need some first aid. We'll be back with more Truth, Justice, and the Longevity Way on Dead Doctors Don't Lie for these messages. Okay, Doug, what pearls of wisdom do you have for us today?
Well, I thought we'd talk a bit about blood pressure, as I've got a story here that came from Fox News. It's headlined, Why Your Blood Pressure Should Be Checked in Both Arms. This is a new study, and they said different blood pressure readings in between the right and left arm could be an increased risk for heart problems later in life. Researchers analyzed the blood pressure readings of more than 3,300 people 40 years and older in Massachusetts and looked at only the systolic blood pressure, which, of course, is the top number. And they said people whose systolic blood pressure readings differed by 10 millimeters of mercury or more between the right and left arms were 38% more likely to have a cardiovascular problem like a heart attack or a stroke over a 13-year period compared to those with smaller differences between their arms. Findings even held when they took into account for risk factors for heart disease, such as high blood pressure, high cholesterol, and diabetes. And the results suggest doctors should consider measuring blood pressure in both arms. The American Heart Association does recommend this, at least in the first visit to a new doctor. But they found in the study when they asked people that most people only got their pressure taken in one arm. This was all published in the American Journal of Medicine. 2012 study linked a difference in systolic blood pressure in the arms to an increased risk of peripheral artery disease, or PAD. So what do you think about that, Doc?
Well, again, these are symptomatic things. You're going to have a difference in blood pressure in your arms, especially your right arm should have a little higher blood pressure than your left arm if you're right-handed. Your blood pressure in your left arm should be a little higher if you're left-handed as opposed to right-handed, because you're going to have more muscle. The arteries are going to be squished more by the muscles in that arm that you have a predominant hand use in. And, of course, they forget to tell you there's 2 basic reasons for elevated blood pressure. One, of course, is mineral deficiencies, particularly calcium deficiency will result in elevated blood pressure. And number 2, people who have kidney disease, or a disease is labeled as kidney disease. Really, it's an artery disease, peripheral artery disease, PAD, which is you get this in your brain, you get vascular dementia. You get it in your eyes, you get glaucoma. You get it in your heart, you get coronary artery disease, and, of course, you get it in your kidneys, you get kidney failure on dialysis and so forth. But really, it has to do with eating inflammatory foods, which cause a reaction inside of your arteries, just like you get a reaction on your finger when you press too hard with a pencil, and you get this sort of little callus where the pencil rubs up against your index finger, and it's not unusual. Same thing happens in your heart arteries, your arm arteries, your leg arteries, the arteries all over your body. And this is all preventable. And so if you do get your blood pressure taken, and it's a millimeter or 2 mercury, different in both arms, between the 2 arms, what you need to do, of course, I would throw in addition to the 90 essential nutrients, I would throw in what we call Ultimate Daily Tablets. It is designed to support and promote healthy blood flow through obstructed arteries. It's designed to support and promote healthy blood pressure. And again, you got to change your diet. You have to be obsessive about the diet. People say, Walt, you're obsessive, man. Well, that's true. Because I will add, many years, maybe 25 to 50 years to your life by being obsessive. And if you're prepared to throw away 25 to 50 years of your life with your kids and your grandkids just so you can eat fried foods or use a lot of olive oil in your salads, well, then go for it. You have every right to do that. But don't expect me to pay for it, through higher insurance premiums and all that kind of stuff. Most of what we do in our cardiovascular system is self-inflicted. Again, the cardiovascular system is extremely sensitive to free radicals, and this is why, as part of your program, you really, in addition to having the 90 essential nutrients, you really have to throw in something like Immortalium, one of our newer products. Immortalium, it actually has anti-inflammatory stuff, supports telomere length despite duplications, and guess what? You'll add many healthy years to your life, but you have to be obsessive. Thank you, Doug. Super job as usual. We'll be back after these messages. Okay, Doug, let's go to callers.
All right, let's head to Marion, Iowa. And Braden, you're on with Dr. Wallach.
Hello, you're on the air.
Hi, I have a horse with a loose suspensory ligament. I was just wondering if there was anything from your products that might help him.
Sure. How much does a horse weigh?
Roughly like 1,000 pounds.
Okay. How old is the horse?
7.
All right. Any particular breed or mixed or what?
He is a purebred Arabian.
Okay,
Gelding.
great. That's a pretty big Arabian. Big stud horse?
No, he's a gelding.
Okay. All right. Big Arabian. Okay, here we go. What I would do is get one of our 40-pound bags of Bloomin' Minerals, which has the 77 certified organic plant minerals in them. I'd get a 50-pound bag of vegetable garden bone meal. It's designed for vegetable gardens for humans. And I would also get a 50-pound bag of Ralston Purina's Omeline 300 for horses because it has molasses in it. It's very sticky. And so what I want you to do is take a 8-ounce coffee cup twice a day, 1 8-ounce coffee cup of the Bloomin' Minerals, 1 8-ounce coffee cup of the garden bone meal, and 1 8-ounce cup of the Ralston Purina Omeline 300, and do that twice a day. In the beginning, that horse will just gobble that up, and it's designed to actually support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae. And, light workouts, you can turn the horse loose in the pasture, you can take them for walks, but don't do any running and jumping and stuff like that for about 90 days. And after about maybe a month, 6 weeks, that horse will slow down. In the beginning, he's just going to eat it like crazy. After about 4 to 6 weeks, he's going to slow down on it, and that's when you want to cut it to just 1 dose a day for maintenance. Give us a call every couple of weeks. Let us know how horse is doing. I deal with very, very, very expensive horses from the Middle East and from Europe, some even from the United States. We're talking about horses valued at millions and millions of dollars each, and this works every time. Okay, let's see. We have time to start another one here, Doug, or are we just about at that moment?
We're just about at that moment.
Okay. Well, let's see here. Okay. Well, I'll just remind everybody, give us a call toll-free, 1-888-379-2552. Again, that's toll-free, 1-888-379-2552. Don't forget, we have supplement programs for pets, too. Arthrodex for small animals, dogs and cats. Arthrodex, 1 scoop for 25 pounds of body weight, and they'll be happy. We'll be back after these messages.
And let's head to Chicago, Illinois. And Michael, you're on with Dr. Wallach.
Hello, Michael. You're on the air.
Hey, Dr. Wallach. Quick question for you. I have a family member who was recently diagnosed with triple-negative breast cancer, and she has chosen not to undergo surgery or any form of chemotherapy. What do you suggest she does as an alternative, and can you talk a little bit about triple-negative breast cancer?
Well, I'm assuming triple-negative means that they're talking about negative to female hormones.
Yes.
Both estrogen, progesterone, and so forth.
Yes.
And there's several different breakdowns of estrogens and estradiols and so forth. So that's what I'm assuming. I've never heard it called triple negative, but I'm assuming that's what they're talking about.
Yes.
And of course, those types of breast cancers, if she was positive, it's driven. The cancer would be made more aggressive by the presence of hormones. Okay, so that's if it's triple negative, that takes away that piece. And makes it, there's no cancer that's safe, but it makes it less aggressive, okay? How much does this lady weigh?
She's around 225, 230, about 5'9".
Okay. Yeah, at 5'9", I'd like to see her at, say, 165, 175 for a lady. So, losing 40, 50, 60 pounds wouldn't be bad. Helps the immune system get rid of that extra poundage. We can work on that, too. But also, you have to clean up her diet because it's a diet that's got her in trouble with breast cancer. There's a wonderful study that came out in 1998 from the University of South Carolina. They looked at a large number of women, and what they looked at was how they cooked their food, particularly meat. They said women who cooked their meat medium rare had a reduction in the risk of breast cancer by 462%. If they cooked their meat very well done, it increased the risk of breast cancer by 462%. Also, there was a wonderful study on two of Youngevity's products by Clemson University. It was in actual human cancer cell cultures, not human beings, but in the human cancer cell cultures. These are in human cells that had breast cancer. And the Ultimate Classic and also the Beyond Tangerine Original actually reduced the risk of breast cancer by 32%. And so I would give either one of those as a multiple for this person, 225 pounds. I'd have them take 2 of the Healthy Heart and Brain packs per month. That's going to allow them to have 3 of our Ultimate Selenium at breakfast and dinner, 1 ounce of the OsteoFX Plus at breakfast and dinner, 2 scoops of the Beyond Tangerine 2.0 at breakfast and dinner, 3 of the EFA Pluses at breakfast and dinner, 3 of the EFAs at breakfast and dinner. All that would be accomplished by the 2 Healthy Heart and Brain packs per month. I'd get another bottle of selenium just by itself so you can take a third dose of the 3 Ultimate Seleniums either at lunch or at bedtime with a glass of water. I'd also get their auric points above 100,000 per day, and they could do that with 5 of the Cell Shield RTQ capsules twice a day. And they come in bottles of 60, so I have to do the math, but I think it's like 4 or 5 of those little bottles because they only come in bottles of 60. And then, of course, triple treat chocolate. Every lady likes chocolate, and this is, unless she's allergic to it, the chocolate would be wonderful. 6 of those a day will get you over 100,000 auric points. And then give us a call every couple of weeks. Anytime this lady goes in for an exam, let us know how she's doing. We'll be back after these messages.
Let's head to Houston, Texas. And Sadi, you're on with Dr. Wallach.
Oh, Sadi, you're on the air.
Yes. Hi,
how can I help you?
Yes, I'm on high blood pressure medication, and I have severe knee pain and back pain. I know I weigh 320 pounds.
Okay, and how old are you?
I'm 52.
Okay, and how tall are you, ma'am?
I'm 5'11".
Okay, so you're a tall lady. Tall lady, I'd like to see you at anything from like 175, 165, 175, I think would be ideal for a lady at 5'11". You're a tall lady, but 320, I'd like to see you maybe lose maybe 160 pounds, 140 pounds. We can do that very easily. But for the knee and back pain, the high blood pressure, what I want you to do is ideally at your body weight, 320, you're going to have to take 3 of the Healthy Heart and Brain packs per month. Okay, it's 1 per 100 pounds of body weight. And Shar, are you there?
I'm here.
And what would you add? What would you add to the 3 Healthy Heart and Brain packs to deal with the high blood pressure? What would you do for the back and the knee problems?
I'd give her the Ultimate Daily for the high blood pressure.
Okay.
And the glucogel for the knee problem and everything.
Knee and back. Okay, very, very good. You get an A+. Yep. For the back and the knee problems, a big girl like yourself, I would have you take 20 of those glucogel a day. 5 at breakfast, 5 at lunch, 5 at dinner, and 5 at bedtime. Okay, the glucogel, that's going to take 3 bottles a month of the glucogel to pull that off. And this is designed to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae. And then on the on the Ultimate Daily tablets, as Shar points out for the high blood pressure, I would have you take 12 of those a day. 4 at breakfast, 4 at dinner, and 4 at bedtime, or 4 at breakfast, 4 at lunch, 4 at dinner. That'll be 3 bottles a month of the Ultimate Daily tablets. And that's going to support and promote healthy blood flow through obstructed arteries. It's going to support and promote healthy blood pressure. And then as you lose weight, we'll be able to reduce the dosage. Now, what would you do for this lady, Shar, for weight loss?
ASAP.
ASAP, and I'd be a little aggressive here. I'd have her get 2 bottles a month of the ASAP, and I'd have her put a dropper full under her tongue 30 minutes before each meal. Let it absorb through the oral tissues. Do not swallow it. And then I'd give it a second dropper full under the tongue 15 minutes before each meal. So they're going to have a dropper full 30 minutes before each meal, a dropper full 15 minutes before each meal. That's going to require 2 bottles a month of the ASAP. And after a couple of days, you'll begin to lose anywhere from a half a pound to 2 pounds a day. We've had people lose 140 pounds in 100 days. It's not unusual. You can lose 60 pounds in 45 days, not unusual. And so this is not going to be a long, painful process. This can happen fairly quickly if you're really good about following all the directions. Keep your calories down to 1,500 calories a day instead of 2,500. Choose what you eat. Stay away from carbohydrates. And I would also get on a gluten-free diet. Char?
Yes.
Now, to be truthful, you resisted me for some time about gluten-free.
Yeah, but it's an epidemic now. The food is so bad. Everybody needs to get on a gluten-free diet. It's really that bad.
Now, can you mess around with this, or do you have to be really obsessive about it?
Oh no, because every so often things happen and I don't know what, and you got to really be aware of what's going on. They put it in everything. They put it in the tomato soup in restaurants, and you found out they put it in the shakes, the vanilla shakes, which is like a malted. They put malted stuff in that. So they put
barley malt, which is actually sprouted barley grain, in vanilla shakes. They should call them a malted, so then you know it's in there. Yeah. I had to ask because I was being so good about avoiding all gluten myself, and then I said, what am I possibly getting? I said, the only thing I really didn't know all the ingredients was this vanilla shake at a fast food place, and I asked them if they put powder in it or if it's just ice cream and milk. They said, oh, no, we have this little envelope of powder. Another one said we put a scoop of this powder in there. I read the label. Barley malt. See, I got to be obsessive. But give us a call every couple of weeks, Saturday, and we'll walk you through this. But this will get you going. We want to hear all the numbers. I want to know your weight, your blood pressure. I want to know about your back and your knee and so forth, and we'll walk you through this, kiddo. Okay, Doug, let's go to callers.
Let's head to Milwaukee, Wisconsin. And Lloyd, you're on with Dr. Wallach.
Lloyd, you're on the air.
How you doing, Doc? I'm honored to talk to you.
Well, thank you, sir. How can we help you?
Well, I've been dealing with this blood pressure thing for the last 3 years. 3 years ago, I went to the doctor, and they told me that I had high blood pressure. And ever since then, I've been taking these pills, and they help it for a minute, but they don't last.
Okay. Now,
I'm sorry.
Yeah, how much do you weigh, Lloyd?
I'm at 190 pounds.
Okay. Any other issues? Any diabetes or arthritis or back problems? Or?
No, sir.
Okay, so blood pressure is your big thing.
Yes, sir.
Okay. Any skin problems? Any eczema, dermatitis, psoriasis, or history of asthma as a kid?
No.
Okay, super. Okay, Shar, this is a Shar thing. 190-pound guy.
Yeah, he needs he needs 2 healthy start packs.
Yeah,
so.
You could go with the basics. Yep, exactly. 2 healthy start packs. Keep it economical. Okay.
Yeah, because it's a calcium deficiency is what it is, and I know that from my husband. Absolute 100%, 110%.
Okay, so what else would you do in addition to 2 healthy start packs?
For
blood pressure.
Blood pressure. Oh, he could. Yeah, he needs to take the Ultimate Daily too.
Yeah, very good. So yeah, I'd have you take Lloyd 1 ounce of the OsteoFX Plus at breakfast and dinner, 2 scoops of the Beyond Tangerine 2.0 NutriCrystals at breakfast and dinner, 3 of the EFA Plus as a breakfast and dinner. All that will be accomplished by the 2 healthy start packs per month, and then the Ultimate Daily tablets, as Shar said, would be 3 at breakfast, 3 at dinner. And, you want to take your own blood pressure every day, keep a logbook, and as the blood pressure begins to drop a little bit, go ahead and begin to wean yourself off the medication. If your blood pressure is in the normal range and you take the, healthy start pack and the Ultimate Daily tablets and it doesn't drop much or even at all, it just stays kind of in that normal range, what you do after a month, then cut your blood pressure medication by 25%. If it stays in the normal range after a month, then cut it by 50%. And if it stays in the normal range, get rid of it, okay? But do it gradually. Don't stop any blood pressure medication suddenly. Okay, Doug, we have time to start another one?
Yeah, we certainly do. Let's head to Monterey, California, and Ronald, you're on with Dr. Wallach.
Well, Ronald, you're on the air.
Hi, sir. Before I ask about my little ailment, can I ask you if there's any teenagers listening who wanted to become like you or study the alternative or the good medicine, how would you advise teenagers? Where would they even go to school? I know not medical schools. What would you say to kids wanting to learn what you know?
Okay. Well, the first thing I would do is have them, if they're teenagers, I'd have them listen to the CDs, Dead Doctors Don't Lie, From Here to Immortality, Deadly Recipe, that kind of stuff, Dead Athletes Don't Lie. Get a hold of all the books, the trilogy of books, read all that, and make a decision. Do they really want to go to college and get 2 degrees or 4 degrees, or do they just want to help people like Char? When we come back, Charlotte will tell us what she's done. We'll be back after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Youngevity and 90 for Life Crusade. And Doug, we're going right back to California and Ronald. Okay, Char. Hello, Char.
I'm here.
Okay, yeah, this is a perfect Char thing because I get asked that a lot. Do I have to go to school to become a nurse or a PA or a doctor? Do I have to be a naturopathic doctor or a chiropractor? What do I have to do to be able to help people through the Youngevity system? And you're the perfect example. I mean, you've been with me for 25 years. How many people do you have to deal with in your organization?
Over 400,000.
Yeah, you're approaching 500,000 now. And how many countries are you in?
15.
15, and how many states?
All 50. 51 if you count Canada.
Well, okay. And do you have any medical training at all?
No, I took a course in welding.
Okay, well, there you go. So, how did you learn how to help all these people? And you've helped people with every disease imaginable. How did you do that? What did you learn? How did you learn?
I learned by listening to your lectures and the CDs and the books. And my sister and I made a gut decision to believe you above and beyond anybody else that we heard, because I think you got it all figured out. And a lot of times, a good share of the time, you're against the grain, and yet you've always been right. I mean, time has proven over and over again that you had it figured out way years before it became kind of common knowledge.
Thank you. So the bottom line is, by listening to the CDs and reading the books and participating in the lectures, listening to the radio program, you can get enough information to help people without a medical degree?
Absolutely. The doctors, they haven't figured it out. Like you said, we're the most obese nation in the world, and if they knew anything, we wouldn't be the sickest people in the world.
Yeah. Okay, very good, dear. Thank you. Okay, well, hang on. Let's see if we can squish another caller in here. Okay, Doug, let's go to a caller.
Let's head to Delaware. And Cindy, you're on with Dr. Wallach.
Hello, Cindy, you're on the air.
Hi, Dr. Wallach. How are you?
Hi. Okay, thank you. How can we help you?
Well, I'm going to talk to you about my main question, actually. I've been using your stuff for 2 months for myself, but that's not... I want to get to my sister, really, because she's a type 2 diabetic.
Okay.
And I just was talking to her yesterday to find out that she's taking literally 8 medications.
Mm-hmm.
And can I list them for you?
Nope, not necessary. I'm sure it's metformin, insulin, diuretics, all kind of stuff.
Yeah, and she's taking Lipitor and 2 blood pressure medications, the digoxin and transine Paxil.
Okay, did you say, wait a minute, did you say digoxin?
Mm-hmm, because she gets tachycardias.
Yeah, okay, so she probably has tachycardia with rapid heart rate. Do you know if she has a back problem at all?
Not to my knowledge, I don't know.
Yeah, tachycardia can be caused by anything from anemia to back problems, usually associated with AFib, atrial fibrillation, and that's why they got her on that digitalis. Is it helping her any?
As far as I know, she still gets them, just not as frequently.
Yeah. Okay, very good. Okay, Char, you there?
I'm here.
Okay, what would you do what does your sister weigh, Cindy?
She weighs about 100 pounds because she pretty much can't eat anything.
Okay, small lady. So here you go. What would you do? And that's about what your weight is. Char's about 95% soaking wet. Yeah. And so what would you give somebody 100 pounds for type 2 diabetes?
A healthy blood and sugar pack, of course.
Well, there you go. And for high blood pressure, what would you throw in?
She needs some extra calcium, and she needs Ultimate Daily.
Okay, so the Ultimate Daily, I'd give her at 100 pounds. I'd even go, since she has all these problems, I'd give her a full dose of 3 twice a day. It's 3 twice a day per 100 pounds of body weight. Be 1 bottle of Ultimate Dailies. Supports promote healthy blood pressure. Supports promote healthy blood flow through obstructed arteries. I would also have her take, as Char said, one healthy blood sugar pack per month, but I'd also have her get an extra bottle of Sweeties so you can take 3 at breakfast, 3 at dinner, check her fasting blood sugar before she medicates herself. And, of course, her blood sugar will drop drastically. I'd also kind of have her look up in the PDR or talk to her pharmacist, but I'd want to get her off the Lipitor, which is going to wind up giving her Alzheimer's disease, adrenal exhaustion, menopause, and all kinds of other stuff. So give us a call every couple of weeks, Cindy. Let us know what your sister's blood sugar is, blood pressure is. Okay, well, thank you, Shar. A very, very super job today. A+, A+. Thank you so much, Doug and Susan. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.